Today we'll be showing you the steps to an arterial puncture. First, we must obtain an ABG kit. We must consult the order for a date, type of oxygen administration device, and liter flow concentration. Check patient's platelet count. And then before we get started, we need to wash our hands. And make sure we wear gloves. All right. Next, we check patient's armband to assure identity.
Mr. Blank, yes, that's you. Is your name Mr. Blank?
And make sure the patient understands the procedure being performed.
You know this is gonna hurt, right? Okay.
If necessary, we assure appropriate FiO2.
Can you breathe? Good.
Next, our first step is going to be have the patient make a tight fist.
That's a good fist.
Then apply pressure to the radial and ulnar arteries. Have patient open hand and release pressure from the ulnar artery. The hand should become flush within 10 to 15 seconds.
That's one flush hand.
Next, position the patient's wrist in a mild extension. Palpate the radial artery with the tips of the index and middle fingers. Cleanse the puncture site with alcohol swab. Using a circular motion, starting from the center of the site and working outward about 1/2 inch around site. Next, we remove needle cap and assure bevel is in the upright position. Palpate the artery with one hand and holds the syringe with the other. Holds the syringe like holding a pencil, assuring a 45-degree angle. Advances needle through the skin into the artery. A flash of blood should appear in the hub of the needle. Blood begins to pulsate into the syringe.
Bam!
Removes needle from the site and applies pressure with the gauze pad for approximately 5 minutes, or until bleeding stops. Locks needle into safety lock. Removes air bubbles and gently rolls or tilts syringe from side to side to mix the anticoagulant with the blood. Removes needle from syringe and places into a sharps container.
Sharps container.
Places label on biohazard bag. Then assures that the bleeding has stopped.
Have you stopped bleeding?
Yes, I have.
Very good.
If bleeding starts again, reapply pressure until leakage subsides.
Wait a minute. You haven't stopped bleeding. Apply pressure.
Dispose of all trash and needles appropriately.
Somebody throw this away.
Wash his hands and transport sample to blood gas lab.
You forgot